Usually, when we're talking about hygiene, there's this very specific, like deeply ingrained picture that comes to mind.
Oh, definitely. The routine we've all been taught since childhood, right?
Yeah, exactly. You step into a hot shower,
Yeah.
you lather up some brightly colored soap, you grab a flannel or a loofah, and you just scrub.
Right. And in our minds, hygiene is practically synonymous with physical friction, heavy suds, and, smelling like a botanical garden.
We really culturally equate cleanliness with aggressive removal.
Mm.
Like the underlying assumption is always that we need to strip things away from the surface of the skin to be truly clean.
Exactly.
So welcome to the deep dive. We are so glad you're here with us today because we're going to ask you to take your entire concept of hygiene, flip it completely upside down, and basically throw it out the window.
It's a total teardown of everything you know.
It really is. Today, our mission is unpacking a fascinating stack of medical leaflets, patient guides, and dermatological guidelines. And they're all centered around answering one very complex question. How do you maintain hygiene when you are living with lichen sclerosus?
And navigating this condition, which we often just call LS, it forces you to rethink literally everything you know about what it means to care for your body.
Because it requires a massive paradigm shift, doesn't it?
Oh, absolutely. For someone dealing with LS, that standard routine of hot water, scented soap, and scrubbing, it's actually the enemy. It is the absolute worst thing you can do.
Right, because LS is a chronic inflammatory skin condition. It usually causes these incredibly itchy, white, fragile patches, most commonly on the genitals.
Yeah, and we really need to emphasize this right at the top just to clear away the stigma that the sources mention again and again. LS is not an infection.
Right. It's not contagious.
No, not at all. And it is absolutely not caused by poor hygiene.
I think that's such a relief for people to hear, because people dealing with this often feel an immense amount of shame, right? Assuming they must have done something wrong or that they simply aren't washing thoroughly enough.
They do, yeah. But LS is generally understood to be an autoimmune issue. The body's immune system is mistakenly reacting against its own skin. It's thinning it out and making it unbelievably delicate.
So the reason our standard aggressive idea of hygiene is so dangerous here comes down to a very specific mechanism,
Mm-hmm.
right? The Kobner response. I've seen that term pop up in multiple guidelines.
The Kobner response, yes.
But how does physical friction actually cause a disease to worsen? I mean, that sounds counterintuitive.
Well, it helps to think of the immune system in an LS patient as a hypervigilant, overly aggressive security guard.
Okay.
So the Kobner response is a phenomenon where physical trauma or friction to the skin sends out an emergency distress signal. Now, in a healthy person, the immune system just sends resources to heal that minor trauma.
Right, like fixing a little scrape.
Exactly. But with LS, that distress signal tricks the hyperactive immune system. It sends this flood of white blood cells that end up attacking the healthy tissue instead.
Wow, so it causes new lesions to form.
Yep. And it makes existing ones much worse. So if you're scrubbing your vulva with a rough flannel or using harsh soaps that dry out and crack the skin, you aren't just causing temporary irritation.
You're actively feeding the disease process at a cellular level.
Precisely. Therefore, hygiene with LS isn't about getting clean in the traditional sense. It's entirely about protection and preservation.
Okay, so since we've established that the ultimate goal is preservation, we have to look at the place where most daily hygiene happens, right? The shower.
Shower, yeah.
The sources describe what is essentially a great unwashing routine. And the very first rule is to ditch the soap completely.
Entirely.
Which is wild. And that includes even the products proudly labeled gentle or sensitive or...
Oh yeah, even dermatologically tested. Those body washes are strictly off limits.
Why is that? I mean, if it says sensitive, shouldn't it be okay?
You'd think so, but most of those sensitive body washes still rely on chemical surfactants. And surfactants are the ingredients that create lather. Their specific job is to bind to oils and strip them away.
Oh, I see.
But LS skin already lacks a robust, protective lipid barrier. So when you introduce a surfactant, you strip away whatever natural oils are left.
Leaving the skin profoundly dry. And dry skin is fragile, easily cracked skin.
Exactly. So instead, the dermatological guidelines recommend using an emollient. That's a thick medical moisturizer like Hydromol or Dermal 500. You use that as a direct soap substitute.
But for anyone listening who is used to their heavy suds, it's hard to imagine getting sufficiently clean without a lather. Like if someone has spent the day sweating, how does just warm water and a moisturizer actually lift bacteria away without leaving them feeling filthy?
It works on a completely different chemical principle. When you mix an emollient with warm water in your hands, the oils and the moisturizer trap the dirt, sweat, and dead skin
Oh,
cells.
so the oil does the lifting.
Right. And as you rinse with water, that trapped debris washes away. But rather than stripping the skin's barrier, the emollient leaves a microscopic protective film behind. You get the cleansing action without the destructive stripping.
It sounds like treating the skin less like a dirty dinner plate that needs hard scrubbing and more like a delicate vintage silk dress.
That's a great analogy.
Yeah, like you wouldn't take a bristle brush and detergent to vintage silk, right? You would just give it the gentlest possible rinse.
That is exactly the approach required. And that gentle rinse means using your bare hands only. Washcloths, loofahs, sponges, even soft flannels, they all have textured fibers that cause the microfriction we discussed.
Which triggers the Kovner response.
Exactly. And the guidelines stress that washing once a day is plenty. Overwashing, even with an emollient, just aggravates the dryness.
And the gentleness extends to drying the skin too, doesn't it? Because the immediate instinct when you step out of a shower is to rub yourself dry with a towel.
Oh, yeah, you have to resist that urge completely. You just gently pat the area instead.
Actually, one of the patient guides had an incredible, completely counterintuitive tip for drying. They suggest using a hairdryer.
Oh, the hairdryer trick, it's brilliant.
Held well away from the body, obviously, and absolutely set to a cool setting. It sounds unusual, but it's a highly effective way to dry the delicate folds of the skin without a single bit of physical friction touching the area.
It really is. But before we leave the shower, there is a hidden cascading danger the sources highlight.
Right.
Because even if you are meticulously using your emollient, washing with bare hands, drying with a cool hairdryer, you could still be accidentally triggering a flare-up simply by washing your hair.
Shampoo runoff. It's a major, often overlooked trigger.
It is. Most people stand upright in the shower to wash their hair with a standard commercial shampoo. When you rinse, all of those harsh surfactants, heavy artificial fragrances, and preservatives wash straight down your body, directly over the genitals.
So you're exposing the skin to the exact chemicals you're actively trying to avoid.
Mm-hmm.
But how do you work around gravity?
Well, the guidelines suggest two practical solutions. The first is to wash your hair entirely separately. You lean over a sink or the edge of the bath so the runoff never touches your body.
That makes sense, though maybe a bit of a hassle. What if that isn't practical?
If it's not, you can apply a thick, heavy layer of your emollient ointment to your vulva before you step into the shower.
Oh, so it acts like a waterproof raincoat.
Exactly. The soapy shampoo runoff simply glides over the oily barrier without ever penetrating to the skin below.
That's incredibly smart.
Oh.
Okay, so since the shower is generally just a once-a-day event, we have to look at the place where this protective routine faces its biggest daily challenge. The toilet.
Yes. The bathroom battlefield.
Maintaining this friction-free hygiene when dealing with urine, bowel movements, and periods feels like a constant uphill battle.
Bodily fluids present a unique chemical challenge. Let's look at urine, for example. Normal, healthy skin has an intact epidermal barrier that naturally repels urine. But urine contains compounds like urea and ammonia. When the skin barrier is damaged, thinned, or cracked by LS, those compounds penetrate the microscopic fissures.
So the urine isn't just a liquid to be wiped away. It acts as an active inflammatory chemical irritant.
Precisely. It causes intense, immediate burning and stinging.
Wiping dry toilet paper across stinging, cracked skin just sounds agonizing, which explains why every single patient guide treats the peri bottle as an absolute necessity.
Oh, it's a game changer. A peri bottle is essentially a small, handheld plastic squirt bottle with a long, angled nozzle. It's frequently used for postpartum care.
And the vital technique here is to fill it with warm water and squirt it over the area while you are actively peeing, right?
Yes, while you're actively peeing.
Because you're changing the chemistry of the exposure in real time.
Yeah.
By diluting the urine as it flows, you dramatically lower the concentration of ammonia hitting the broken skin.
That dilution halts the chemical irritation before it can even start. And then rather than wiping, you just gently pat dry. The type of paper matters too.
Bleach and perfumes and standard toilet paper are irritants.
Highly irritating. So the sources strongly suggest unbleached, chemical-free paper made from recycled fibers or bamboo. Alternatively, a simple cotton pad moistened with tap water is incredibly gentle.
There's actually a brilliant patient life hack from the Lichen Sclerosus guide for when you aren't in your own bathroom. Because, a peri bottle isn't exactly pocket size.
No, it's definitely not.
They suggest buying a standard, tiny travel spray bottle, the kind meant for hairspray. If you open it and pull the little inner plastic tube out, the bottle will still spray, but only when you hold it upside down. It becomes a perfectly discreet, on-the-go dilution tool.
That is a wonderful adaptation. I love that. And for bowel movements, applying a small amount of emollient directly to the toilet tissue before you wipe acts as a lubricant.
Oh, nice.
Yeah, it virtually eliminates the scratchy, frictional feeling on the sensitive, often damaged skin around the anus.
But urine and bowel movements are just one part of the equation, though. Any bodily fluid that introduces moisture or chemical friction is a threat, which makes managing menstruation an entirely different battlefield.
It really is.
The standard sanitary pads most people grew up with seem fundamentally incompatible with LS.
Oh, they're essentially designed to do everything LS skin hates. Think about it. Most commercial pads and panty liners are made of synthetic, non-breathable materials. They're often bleached and sometimes aggressively fragranced.
And when they sit tightly against the vulva, they trap body heat and moisture.
Exactly. This alters the natural pH of the skin, it breeds bacteria, and creates constant physical friction as you move. The dermatological consensus is to avoid them entirely.
So the alternatives focus heavily on either keeping the blood completely away from the vulvar skin or using highly breathable materials. Period underwear seems to be a massive help here, absorbing fluid without the synthetic chafing.
Period underwear is fantastic. Internal options like menstrual cups, discs, or unbleached, unscented tampons are also highly recommended.
And, of course, utilizing the peri bottle to gently rinse away menstrual blood so it doesn't dry and crust on the sensitive tissue.
Yes. The rethinking process never really stops, though. Because once you leave the bathroom, your skin is in constant, hours-long contact with clothing. Hygiene in this context expands to include the fabric sitting against your skin and, crucially, what chemicals you use to wash that fabric.
The physical friction of clothing is a huge factor. The source is unanimously warned against thongs, tight denim jeans, and synthetic activewear leggings. They recommend 100% loose cotton, bamboo, or silk underwear.
Or, frankly, just wearing a long, loose skirt with no underwear at all when you're at home, just to maximize airflow.
That makes a lot of sense. But the part that really caught my attention was the laundry detergent. Even if you buy the softest organic cotton, the way you wash it can turn it into a chemical hazard.
Yes, biological washing powders. They are incredibly effective at cleaning clothes because they contain specific lab-engineered enzymes. They use proteases to break down protein stains and lipases to break down fat stains. That is fantastic for getting a food stain out of a shirt. But those microscopic enzymes do not always rinse completely out of the fabric in a standard washing machine cycle.
So when that fabric sits intimately against skin affected by Lichen Sclerosus skin that already has a severely compromised protein and lipid barrier, those lingering enzymes are actively attacking it. You are essentially marinating in the very chemicals you are trying to avoid.
It's a terrifying thought, but yes. The guidelines advise abandoning biological powders and heavily fragranced fabric softeners completely. Wash your underwear separately from the rest of the household laundry.
And in many cases, running a very hot wash cycle with absolutely zero detergent is the safest way to clean the garments without leaving behind a destructive chemical residue.
Exactly.
We also have to factor in sweat. Exercise is encouraged for overall health, but sweat introduces salt and moisture, which irritate the lesions. Sitting in wet swimwear or sweaty gym clothes is a major trigger.
The protocol is to immediately remove wet clothing, take a brief shower, or at least cleanse the area with a moist cotton ball and some emollient, and then immediately reapply a fresh protective barrier.
And while we're talking about managing the hair and skin in that area, we have to look at hair removal.
Right, because pubic hair actually acts as a natural buffer. It physically protects the delicate vulvar skin from the friction of clothing. But if a patient chooses to remove it, the standard methods are highly problematic.
Because shaving with a razor drags a sharp blade across fragile tissue, causing microscopic lacerations.
And waxing forcefully rips the top layer of epidermal cells away from the body. Both of these inflict the exact kind of trauma that sends the immune system into Koebner response overdrive.
Gentle trimming with scissors or professional laser hair removal are the safer bets. But the guidelines stress that even these should only be attempted when the LS symptoms are entirely dormant, with no active inflammation or broken skin.
Looking at all these interlocking rules, the travel bottles, the unbleached paper, the specific laundry cycles, the careful exercise routines, it really highlights a staggering psychological burden.
Yeah, managing hygiene with LS isn't just a physical checklist. It is a profound lifestyle adaptation.
It requires a constant, exhausting mental calculus. It means constantly scanning a restaurant to see if the restroom offers enough privacy to manage a flare-up.
Right, or worrying about heavy ointments staining your clothing. It requires incredible daily resilience just to maintain a baseline of comfort.
Absolutely.
We've established how many traditional cleaning agents we have to take away, which leaves us heavily reliant on the products we are actively putting onto the skin to build that protective shield.
Yes, the emollients and steroids. They are the two pillars here.
But they come with incredibly specific rules for application and one truly surprising safety risk. Let's look at the emollients first. Why do the medical sources specifically push patients toward heavy ointments rather than lighter creams or lotions?
It all comes down to water content and the chemistry of preservation. Creams and lotions feel lighter and absorb quickly, specifically because they contain a high percentage of water.
Okay.
But anytime you have standing water in a product, bacteria will naturally try to grow in it. To prevent a lotion from spoiling on the shelf, manufacturers must add chemical preservatives.
Oh, and when you apply those chemical preservatives to broken, inflamed LS skin, it triggers intense stinging.
Precisely. Ointments, however, like pure petroleum jelly or a 50-50 mix of white, soft, and liquid paraffin, are entirely oil-based. They contain virtually no water.
Which means they don't require those harsh preservatives.
Exactly. They are heavy and greasy, but they perform a vital function. They sit entirely on top of the skin, locking the body's internal moisture in while providing a thick, impenetrable physical shield against urine and friction.
The hospital leaflets also include a very specific warning about tub hygiene. If you have a large 500-gram tub of ointment, you should never dip your fingers directly into it.
No.
You run the risk of introducing bacteria from your hands into the tub, contaminating a supply that might last you for months. You should always use a clean spoon or a spatula to scoop out the portion you need.
Yes, tub hygiene is crucial. Now, emollients soothe and protect the skin, but they do not treat the underlying autoimmune inflammation.
Right, to stop the disease process and prevent severe anatomical changes, like the vulvar tissue physically shrinking or fusing together, doctors prescribe highly potent topical steroids, with clobendal propionate being the absolute gold standard.
Clopidogrel propionate is a powerful medication, and the timing of how you apply it in relation to your emollient barrier is critical for it to actually work.
The sources refer to this as the 20 to 30-minute rule.
Yes, the 20 to 30-minute rule.
I imagine the instinct is to just apply the steroid and the emollient at the exact same time to save yourself half an hour of waiting around. Why is that 20-minute gap so crucial chemically?
Well, if you apply them together, two detrimental things happen. First, the heavy oil of the emollient dilutes the active steroid, significantly reducing its ability to halt the immune system's attack.
Oh, that defeats the whole purpose.
Right. And second, the physical action of rubbing the greasy emollient in will accidentally slide the highly potent steroid off the targeted lesions.
And spread it onto surrounding healthy skin that doesn't even need it.
Exactly. The steroid requires at least 20 to 30 minutes of undisturbed time to fully penetrate the basal layer of the targeted tissue.
So you apply the steroid, go make a cup of tea, read a few pages of a book, and only then return to apply the protective barrier ointment over the top.
It is yet another layer of that mental calculus we were talking about.
It really is. But there is a caution box printed in the British Association of Dermatologists leaflet that brings an entirely unexpected danger to light.
Flammability.
Oh, yes. It is a critical safety warning that catches many patients completely off guard. Because the ointments themselves are incredibly safe and soothing for the human body, but because they are heavily oil-based, they fundamentally alter the physical properties of any fabric they touch.
Because you wear them constantly, right? So the oils slowly soak into your cotton underwear, your pajamas, and eventually your bed sheets.
And oil dramatically lowers the ignition point of fabric.
It does. The oil builds up deep within the fibers of the cloth. Even if a pair of pajamas has been washed and feels entirely dry to the touch, that microscopic oil residue often remains.
That is terrifying.
If that treated fabric comes near a naked flame, a dropped cigarette, a bathroom candle, a gas stove, it acts as an accelerant. The fabric catches fire much faster and burns significantly hotter than untreated material.
Which makes the laundry advice we discussed earlier a matter of physical safety, not just avoiding irritation. You have to wash clothing and bed linens frequently and thoroughly to remove that cumulative oil buildup, even while balancing the need to avoid harsh biological detergents.
Exactly. And there is one final chemical reaction regarding oil-based ointments that impacts sexual hygiene.
Oh, right. Latex.
Yes. Oil actively dissolves the polymer chains in latex. If a patient is using an oil-based emollient as a barrier or a lubricant to prevent friction during sex, and they rely on latex condoms for contraception or STI protection,
The oil will cause the latex to chemically degrade and split in a matter of minutes.
it is imperative to use polyurethane or other non-latex alternatives.
So the vintage silk dress requires a fire extinguisher and highly specific non-latex condoms. The depth of adaptation required is just staggering.
It really is.
When we pull all of these sources together, the dermatology guidelines, the patient guides, the hospital leaflets, the overarching message is incredibly clear. Managing lichen sclerosus requires abandoning the suds, the scrubs, and the botanical scents.
You trade them all in for the gentle dabbing of warm water from a peri bottle, heavy paraffin ointments, and breathable cotton.
You stop trying to aggressively wash the skin, and you focus all your energy on fiercely protecting it.
And looking at the sheer volume of irritation caused by normal soaps, artificial dyes, and biological detergents on compromised skin, it raises a really profound question about how we view hygiene as a society.
It makes you look very critically at the multi-billion-dollar feminine hygiene industry.
Definitely. We are constantly marketed a vast array of scented washes, wipes, and perfumes. They're all selling the anxiety that our bodies are inherently unclean and require chemical intervention.
We are taught to strip our natural defenses away.
Exactly. But perhaps true hygiene, whether you are managing a condition like lichen sclerosus or not, isn't about chemically erasing the skin's surface. Perhaps true hygiene is fundamentally about respecting and preserving the skin's natural barrier.
The next time you step into the shower and reach for that brightly colored, heavily perfumed bottle of soap, maybe remember the vintage silk dress. Our bodies might benefit from a little less scrubbing and a little more respect. Thank you for joining us on this deep dive. We'll catch you next time.